Hello, my name is Gabby Peruzzi, and this is my Safe Injection Site PowerPoint for Political Science 181. This slide is talking about the opioid epidemic, and I have a definition of the opioid epidemic by the National Institute of Health, and it defines it as the misuse of and addiction to opioids, including prescription pain relievers, heroin, and synthetic opioids such as fentanyl. You'll see this diagram off to the lower right-hand corner. It's a geographical map showing the number of overdose deaths involving opioids by county. The dark red shows 25 plus deaths per 100,000 people, and you can see there's some dark red in the western area, and also in the middle west area seems to be pretty populated with these deaths. The highest, though, would be New Hampshire, Ohio, Rhode Island, West Virginia, and Kentucky, with all of them being above 25 people dying of an overdose. This next slide is just some statistics from 2016 related to the opioid epidemic. So in 2016, 116 people died every day from an opioid-related drug overdose. 11.5 million people misused prescription opioids. 42,249 people died from overdosing on these opioids. 2.1 million people had an opioid use disorder. 948,000 people used heroin, and 170,000 people used heroin for the first time. So that's a large population of people using heroin, and not only do we already have people using heroin, we have an additional large amount of people beginning to try heroin, and that leads to possibly becoming addicted to heroin and could lead to an overdose. We also have 2.1 million people misuse prescription opioids for the first time, and there's just a few more statistics about it, but another big one would be 15,469 deaths attributed to overdose. This next slide is a few more statistics. So in 2016, more than 64,000 deaths from overdoses were due to the symptoms of overdoses not being observed. This is a very important statistic in the sense of these safe site injections, as we'll talk about later, that you would actually have nurses observing the patients for these overdose symptoms that are going unobserved and leading to the deaths, because these overdoses can be fixed or reversed by medications such as Narcan. And the other statistic is in 1 year, more people have died from overdoses than the number of American soldiers in the entire Vietnam War. This statistic to me really stood out because in the Vietnam War, so many American soldiers had died, and now we have people dying from drugs that could be reversed. This next slide talks about pathology of the overdoses. So an overdose occurs when a toxic amount of a drug or combination of drug overwhelms the body, which leads to decreased ability of the brain to tell the body to breathe. And when you don't breathe, you're not oxygenating your body well, which leads to overall your tissues aren't getting enough oxygen, your brain isn't, your heart isn't, and that will eventually lead to death because your body cannot compensate for the decreased amount of oxygen. Some symptoms of overdoses are your lips turning blue, constricted or non-responsive pupils, unresponsiveness in general to voice, to pain, to sound, loss of consciousness, and cool, clammy skin. These symptoms are often not seen in the dying moments of its victims, resulting in the lack of being able to respond appropriately with the antidote of Narcan or other medications, like the previous statistic said about 64,000 people dying in 2016, related to not being able to be treated in time. And in the lower right-hand corner, there's just a picture showing you the different symptoms that you might see with these overdoses. So talking about these safe injection sites, at these sites you have trained professionals, clean needles, Narcan, which is the antidote for opioid overdoses. People can bring their own drugs, and it offers long-term treatment such as rehab information and drug support groups. This allows people to come and be immediately treated if they have a reaction to the drugs, or they will already be observed because they are at one of these safe injection sites using the drugs. This slide talks about counterintuitive thoughts, being as what people think when they hear these safe injection sites, what some of their concerns could be. So some of these would be giving people needles, allowing them to overdose with the needle supplied, giving the drug users the space to use the drugs, supporting the behavior of doing illegal drugs or using illegal drugs, and increasing drug-related crimes rates. These are all thoughts that are rational, however, evidence-based research does not support these thoughts. The reality of safe injection sites are that studies have been done, multiple studies, and they all show these results as listed. So decreased overdose deaths due to prompt treatment and identification of the signs and symptoms of an overdose. Increased participation in drug treatment because some people get on the wrong path for simple reasons, and if they go to these safe injection sites, it allows for them to see resources and they can talk to staff about those possibilities. Decreased discarded needles on the street. This one, to me, since I am a nursing student, is very potent because there are people that do not use illicit drugs walking on the street, and they could step on a dirty needle and pick up diseases that can be fatal, such like AIDS or Hep B, Hep C. So this improves life for those that do not do drugs due to the safe discarding of needles that have been used for drugs. Another reality would be decreased drug use on the sidewalk. So there's a place for people to go and use these drugs, which allows them to not do them on the sidewalk and to not do them within the community, but rather in a safe space that the drugs can be discarded correctly, the needles discarded correctly. There is no impact on drug-related crimes as previously thought and said on the slide. People thought that if there was a place to do drugs, that there would be more crimes related to these drugs. However, it's not supported. And then the last would be increased public order. So it allows for people to have an order to follow and to have a place to go instead of just being spread out and doing the drugs, using dirty needles as they please. The first safe injection site was opened in 2003 in Vancouver, British Columbia, Canada. This was the first North American safe injection site, seeing as there are over 90 safe injection sites internationally. This operates on a harm reduction model, which is a model that strives to decrease the adverse health, social, and economic consequences of drug use without requiring abstinence from the drug use, which means that they strive to promote healthy behaviors and to hopefully bring these patients to wanting to seek help and treatment, but it does not require them to give up the drug. This operates under the Health Canada, so it exempts them from prosecution under federal drug laws. And some statistics where in the immediate city where Insight was located, 35% reduction was found in the overdose deaths, and in the rest of the city surrounding this Insight, 9% reduction in overdose deaths. So if you think about that, 35% is a major reduction of people that are not dying, and this is due to the ability of getting the medical attention they need right away, using the clean needles, which prevents the spread of diseases like Hep C, Hep B, and AIDS, and it overall promotes the well-being of the patients using these drugs. On-site is a detox facility in Vancouver available for the clients of Insight. So if patients that come to Insight decide that they want to seek treatment, this is where they would go. So there are 12 rooms with private bathrooms, and they have access to mental health workers, counselors, nurses, and doctors. And the idea behind this detox facility is to stabilize the patient and then to begin to plan their recovery. The staff are located here, and they treat the patients. So it helps them to create a relationship between patient and provider to help the patient want to become clean and start a new life. Again, on-site is the detox facility, and once these patients are stabilized by the nurses and the doctors, the clients can be moved to the third floor, which is a transitional recovery housing, where further recovery and connection to the community is emphasized, along with support programs and housing. The clients are supported in activities such as connecting to family and seeking employment. This detox facility allows clients to feel safe and empowers them to seek treatment for their addiction, begin a new life with being honest with their family, as well as seeking employment to begin building their own financial life. The Powell Street Getaway was opened in July 2017 in Vancouver. Staff completed multiple health promoting activities, such as monitoring the clients for signs and symptoms of overdose at 5 of the booths. They teach their clients safer injection practices, and they refer clients to other health services such as substance use treatment and counseling. This is another safe injection site for clients with addiction. These are all of the actions of promoting healthy lifestyles and shows the client that they are being supported in seeking treatment, or they can just be in a safe place when using the drugs, knowing that if they have a reaction, they will have support right there. The first picture on your left is just the exterior of the Powell Street Getaway, and the picture on the right is supplies that are given to these patients coming in, with 12 injection booths, and the yellow bins are where they can safely dispose of their dirty needles. This slide on the left, it shows when clients are done injecting. This is a safe environment for them to relax. They are offered juice, coffee, snacks, and they're able to talk about staff if they do want to seek out treatment. And on the right is just a picture of the bins with the supplies that each client gets. So they get syringes, sterile cookers, filters, water, and tourniquets. Current safe injection sites. Seattle and San Francisco are on track to open their sites. Philadelphia was just approved to open one, and Boston, Ithaca, and New York are also considering opening safe injection sites in. This summary slide just pulls together all the information within this PowerPoint presentation. Safe injection sites promote clean injections, seeking treatment, and moving forward with a healthy lifestyle. Safe injection sites do not promote drug-related crimes or increased usage of these drugs. And research provides information that suggests and proves that safe injection sites increase patient outcomes and decrease overdose. And this is the last slide with just the references of the websites that were used to gather the research and information for this PowerPoint. Thank you for listening.